and thank you for joining us. My name is Olayemi Durotoye, a pediatric consultant, in conjunction with El Gracia Child Health Foundation, Ogun State. This morning, I will be talking about respiratory conditions in children. What are respiratory conditions in children? It's generally any condition that has to do with the airway and the lungs of a child. And what do I mean by airways and lungs? It just comprises of all the organs and the systems that are responsible for our breathing. That means intake of oxygen into the body and its distribution into the cells and ultimately to every part of the body. To start with, let's look at a bit of anatomy. The respiratory system or the respiratory tract is divided into two portions, and these are the upper respiratory tract, which starts with the external nerves to the bifurcation of the trachea. Don't let me bore you with a lot of anatomy. It just starts from the nose down to a place inside the lungs, while the rest of from the bifurcation of the trachea down to the alveoli constitutes the lower respiratory tract. Children can have a wide range of conditions affecting the respiratory tract, and this will tell on how they are able to breathe in and out, and ultimately will tell on other systems of the body. Common conditions that affect children include congenital conditions, which are conditions that children are born with and go on to affect any part of the respiratory tract. Others are acquired conditions, like the infections. Then we have the hypersensitivity conditions of the airway. Also, briefly, I will talk about choking. It's very important as parents and as caregivers to know about choking in children. Let me start with the congenital conditions. The congenital conditions are malformations or, let me say, things that go wrong with the formation of either the nose, the pharynx, the larynx, down to the trachea before a child is born. Of all this, the most common one seen in this environment, which I'll talk briefly about, is what is called tracheomalacia. And this usually is noticed in children. And what happens in tracheomalacia is that the cartilage that form the wall of the trachea is soft. In normal children, it's supposed to be firm and solid, such that when the child is breathing out, the wall of the trachea does not collapse. But in children with tracheomalacia, what happens is that the wall of that cartilage is soft, so that when the child is breathing out, the wall of the trachea collapses and it makes a sound. So usually the mothers will come into the hospital to complain that this child usually makes a funny sound, even when the child is sleeping or the child is awake. But when they turn the child over, the sound usually will stop, then it will start again. For most children, it is a self-limiting condition because as the child grows older, the walls of the cartilage get stronger and the sound will stop. For most children, usually there are no respiratory problems, there are no systemic problems with it, and so the child can live with it. I will just stop there so that I don't talk too much anatomy or something that will just throw you off balance. Now let's talk about the acquired respiratory conditions. The most common ones are infections, and most common of the infections is pneumonia. Pneumonia, let me just break this table today. It's not something you get from drinking cold water or something you get from putting on the fan at night when you go to sleep. Pneumonia is actually an infection of the lung tissues, and which most commonly may be viral or bacterial. In some cases, very rare cases, it might be caused by fungi, but bacterial pneumonia is the most common acquired respiratory condition in children. Viral pneumonias are common too, but they are not common in this our own side of the world. So talking about bacterial pneumonia. Bacterial pneumonia usually is caused by gram-positive bacteria, Streptococcus pneumoniae is the most common cause. And usually the signs and symptoms that are seen in children include fever, a cough, and fast breathing. Some children may not even have so much of a cough, but the mothers may just notice fast breathing when the child has a fever. And usually when they come to the hospital and they are attended to by the healthcare professionals, they find out that the child has different types of noises that are made in the chest, and so they are given a diagnosis of pneumonia. For some, pneumonia varies, has different grades. From mild, some may be moderate, and some may be severe. And those severe ones usually will require hospital admission, they require supplemental oxygen and all of that. Viral pneumonias, like I said, are not usually common, but they would also have the same symptoms: fever, fast breathing, and cough. But when a child is being investigated, and then the child goes on to have a complete blood count for the bacterial infections, you see that the neutrophil count is usually very high. The WBC count may also be, the total WBC count may also be very high. Then for viral pneumonias, you see more of the lymphocytes being high in that case. So one is able to distinguish whether it is viral pneumonia or bacterial pneumonia. Because for viral pneumonias, antibiotics cannot be used because antibiotics have no effect against bacteria. But for bacterial pneumonias, antibiotics have no effect against viruses, But for bacterial pneumonia, once you have done your test and it's proven, you go ahead to give oral antibiotics or parenteral antibiotics, oral antibiotics or intravenous antibiotics as the case may be. So one thing I want mothers and other caregivers to know is that some children are banned from taking cold water for the rest of their life because they know they'll say it will cause the child to have pneumonia. Pneumonia, no, is not due to cold water. It's due to either a viral or a bacterial infection in the lungs. So how do we prevent this? How we prevent this is make sure that your child is always in an hygienic environment. And then when your child has to go out or in school, there's somebody coughing nearby, or the child comes in contact with an adult that is coughing, then the child should be taught how to protect himself by wearing a face mask, because most of these germs that cause pneumonia, they are airborne. So if you have a cough, please, it's advisable that you quickly go and seek treatment so that you don't go ahead to spread this cough into the environment. Children are particularly vulnerable in getting pneumonia, especially when they have come in contact with an adult that is coughing. For viral pneumonias, it's usually supportive management is the way by which we manage viral pneumonias. We bring down the temperature, supplement with oxygen in case the child has hypoxia, which is low oxygen levels, until the child gets better, because viral pneumonias are usually self-limiting. Then, before I go away from pneumonias, it's important to ensure that a child is vaccinated against the common organisms that cause pneumonia, and these vaccines are given on the national program for immunization schedule for vaccinating children. So moving on now, because my time is very short, I would like to quickly talk about a condition in children that is called childhood asthma. Childhood asthma is one of the different hypersensitivity state of the airway in children, but asthma is the most common, and it brings a lot of concern, a lot of anxiety to parents. That's why I'm choosing to calm down and just briefly talk about asthma. Asthma in itself is not an infective disease. Asthma simply means hypersensitivity of the airway. And what this means in layman terms is that the lung is trying to protect itself from external factors. It may be cold air, it may be dust, pollen, or smoke, or any foreign thing that may get into the lungs. Usually, everybody's lungs have that protective mechanism. But in the case of people who have asthma, it's just that the airway is hypersensitive. It means that the airway or the lungs overprotect itself. And so what happens is that when a child comes in contact with any of these agents, we call them trigger agents. When they come in contact with any of these trigger agents, what happens? The airway closes up. It tries to close up itself so that those foreign things don't get into the lungs. And then what also happens is that the lung produces a lot of mucus to be able to waft off or drive out that foreign body that has entered into the lung. So you see the person coughing a lot, and then the cough reflex is initiated. So the person coughs a lot in order to use that mucus to bring off whatever it is, the foreign body that has entered into the lung. So in a nutshell, that is what happens in asthma. And so asthma is a chronic illness, or let me say a chronic hyperinflammatory condition of the airway. Chronic because it stays there for a long time. Because what happens is part of the body's constitution. So it happens from time to time. For some children, there are times in which they are free. They don't have any attacks, they don't have any crises, they don't have any episodes of chest tightness or excessive cough or difficulty breathing. But for some children, they have it regularly. So if you notice that you have a child that is always coughing, there's no fever, most times maybe there's no fast breathing, but they have this difficulty with breathing or chest tightness. And what that chest tightness is described as is that they are not able to take a deep breath. They are not able to get the air into the lungs. So they complain as if they feel like there's a load on their chest, or that the chest is tight. So if you've ever seen a child, or you have a child who has those kind of complaints, it is time to take the child to your healthcare professional to look at the child and tell you what to do. How do we make a diagnosis of asthma? The diagnosis is both clinical and then also laboratory. Do I say laboratory now, or let me say clinical? Yes, and then also by spirometry. That's what the name of the test is usually that they go to do in the lab. But in children less than the age of 5, because the spirometry requires cooperation and a level of cognition to be able to perform it optimally, if I can use that word, optimally. Before the age of 5, we usually make a clinical diagnosis of asthma. So if you have a child has recurrent cough, noisy breathing, sometimes noisy breathing, they are breathing and then you can hear their breath. It sounds as if they are whistling. There's some whistling in the chest. Some mothers will even put their ears close to the chest of the child, and then they can hear those sounds. It's time to bring your child to the hospital for your healthcare provider to take a look at the child and tell you what to do. Management of asthma, because I'm sure you have seen quite a number of children with asthma who just carry about what is called an inhaler. That's not all that there is to the management of asthma. Asthma, like I've said before, is a chronic illness. So there is a long-term management, which is a day-to-day management of the asthma to keep the hypersensitivity at a low level. And then there is the care that we render when a child has an acute exacerbation or an acute attack. Let's say there's a child who has had a background of this recurring cough and chest tightness, but then the child has been well, but comes in contact with what we call an inciter or a trigger. So at that point, the child starts to have an exaggerated response, and it can be so severe that the child may become hypoxic. That means that the levels of oxygen in the blood start to drop. So for the acute exacerbations, the mild ones can be taken care of at home by just giving the child an inhaler and then you observe. But if after observing you see that the chest tightness persists and the child is still not able to breathe well, then it's time to come to the hospital. For this very severe ones, usually when the child comes to the hospital, the healthcare provider will know what to do to relieve that acute exacerbation. So my time is fast spent, like I said before. But before I go, I'll briefly like to talk about choking in children. This is very important because choking may seem like a minor event but can be fatal in some children if it is not quickly attended to or the person around does not know what to do. When a child is choking, is not the time to start shouting, "Oh, help me, oh this, oh that," or just being completely clueless. No. Everybody, a caregiver, teachers, everybody must know what to do. Parents must know what to do when a child is choking. It's important because many of the things our children play with have movable parts. They have small parts that are usually colorful, and children like to put things in their mouths, in their nose, some in their ears, and it's part of their play. But we must know what to do when the child is choking and how to prevent choking. To prevent choking, make sure that children that are less than the age of 3 do not have any toy or anything they are playing with that has small removable parts. Because while they are playing, this part may come off, and before you say Jack Robinson, the part is already in the child's nose or in the child's mouth, and the child may easily choke on this. So you make sure that the toys that children are playing with are solid all the way, from top to bottom. They are solid. They don't have any parts that can easily be broken or easily be removed. And also, another way by which children choke is by the wrappings that come with their toys, or even the wrappings, the nylon bags that we use at home. Usually they put it over their head, and when they blow air into it, it looks like a balloon to them. So they feel like they are wearing a balloon over their head. But some of it may, get tangled around the child's neck, and the child is not able to breathe, or the child may be able to breathe the little hair that is in the bag, but before you know what's happening, the oxygen supply is cut off, and then the child becomes unconscious. So we must closely, or we must importantly make sure that this does not happen. Things like nylon bags or wrappings are not lying around, and our toys don't have those kind of parts that can easily remove, and then a child chokes on it. But what do we do when a child is choking? There is a universal sign for choking, and that is demonstrated by the child either putting their hand on the neck, indicating that they have difficulty with breathing. But some children may just be making hand signs, and you see them either having difficulty with breathing, and they are trying to make words and the words cannot come out. Some children may just turn blue and the mouth, around the lips, and so we must know what. That is not the time to panic. That is not the time to start pouring water on the child's head, or carrying the child from point A to point B. That is the time to take instant action. What one will do will depend on the age of the child. If the child is a toddler, between the ages of 1 to 3, what to do is to place the child. You'll be seeing a video of it immediately after this that I'm saying. You place the child across your arm. You place the child across your arm, you steady your hand. and then you put your fingers to open the child's mouth, and then with the heel of your palm, you deliver 5 sharp blows or 5 thrusts to the back of the child. So you are holding the child, your hand is steady, the mouth is slightly open, then you go 1, 2, 3, 4, 5. You flip the child over to see whether the object has come forward. So what you are trying to do at that point is to increase the intrathoracic pressure to force out whatever may be in the child's airway. If you flip the child over and the object hasn't come, you deliver the 5 blows again. That you are able to do up to 3 times, and if the object does not come, you move immediately and be on your way to the hospital. If it's a bigger child that can stand, what you do is, of course, what I mean by stand is that at that time the child can cooperate with you. You make the child to stand, and then you pat the child's legs and put your own legs in between. As I said before, you'll see a video demonstration of this thereafter. Put your legs in between the child's leg, and then you put your hand, you make a fist with one hand, and with the other hand you place your other hand on it, and you put your hand on the upper part of the child's abdomen, and then you use this hand over your fist and you press down inward, you press down forcefully inward on the upper part of the child's abdomen. And what you aim to achieve by this is to create an increase in intra-abdominal pressure, which will lead to increased intrathoracic pressure, and then force out whatever it is that may be blocking the airway. So that is what to do when a child is choking. And also, it's very important, like I said before, that we even prevent choking from taking place in a child. Let's keep very good watch on our children, on the type of toys they use, and on the type of things they play with. And also to prevent choking, we make sure that children that are less than the age of 2, do not give them food that is particulate in nature. I mean, like granules, like corn seeds, like fruits that have big seeds in them, like the African cherry. All this kind of seeds can easily, go down into the airway of the child and cause choking. Some children even choke on something as common as popcorn. So we just need to watch our children closely. My time is up now, and so as a recap, today we have looked at respiratory conditions in children, and we talked about congenital conditions, which are conditions that children are born with. I mentioned specifically about tracheomalacia, the signs and what to do about it. I also talked about the acquired respiratory conditions, which are mostly infections, and I spoke briefly about viral pneumonias and bacterial pneumonias. There are other types of pneumonias, but time will not permit me to go into all of them. And then I talked about hypersensitivity conditions of the respiratory tract, most commonly asthma, the signs, and then what to do when the child is having an acute exacerbation of asthma, and then the long-term management, which involves the daily use of inhalers. Then finally, I talked about choking in children, how to prevent, and what to do when the child is choking. Thank you very much for your rapt attention and having come with us thus far. Have a pleasant day.